Hi everybody. I'm joined by my two colleagues, Michael and Catherine. As I say, I work in the National Health Sustainability Office, so it might be news to some of you, even though you work in the HSE, that we have a National Health Sustainability Office. But that's our website, and I'd like you to check it out later today. And also, if you haven't got a copy already, this is our business card. It's a temperature probe for your office to check if your HSE office or any office is overheating, and then contact us if it is. Okay? Now, so my presentation in 15 minutes, the HSE is a very big place, but in 15 minutes I'm going to outline the HSE as an organisation. Then I'm going to look at the sustainability drivers that are driving sustainability within the HSE as I see them. And then I'm going to outline the HSE response to date, and I want you to tell me if what we're doing is good enough. Oh, this thing, sorry. So the National Health Sustainability Office, we're within the estates function, the engineering, property, capital management function of the HSE. We were set up in 2013 by the previous CEO of the HSE. We have a new CEO appointed this year, Paul Reid. And we're part of the Director of Health Business Services. So the HSE is so big that the estates function, the procurement function, the non-frontline healthcare function actually has a division of its own and our own logo, etc. So I'm not sure to date where Paul Reid is in relation to sustainability, but I'm hoping he's going to be as good an advocate of sustainability as our previous CEO was. The HSE were big spenders, so we spend a lot of money. We have a 16 billion annual budget. A lot of that is with regard to procurement. We buy a lot across the public sector. We're big spenders. So we also have a lot of money that we spend on building new buildings. Every hospital campus is a building site. We build new buildings, we maintain the buildings that we've got. Our annual energy bill for heat, light and power is 69 million euros, 70 million euros per annum the health service spends on energy. Since 2009, we have actually saved about 25 million in relation to energy efficiency projects. So we're big spenders. The HSE portfolio of properties, I work within the estates function, so I'm just going to outline that just to profile the HSE. We're nationwide. We reach into every village, every town, every city of this country. We are, we have 49 acute hospitals that are equivalent to university campuses. Only one of those hospitals to date has been accredited with a green campus flag. But we're hoping that the other 9 acute teaching hospitals will be able to get a green campus flag. And what I see is green campus students and from colleges coming to work for the HSE, and they're asking us what we're doing about sustainability, which is brilliant. We have nursing homes, nursing home units in all over the country. We have an ambulance base and fleets. We have primary care centres. Some of our buildings work 9 to 5, Monday to Friday, but a lot of our buildings are 24/7, 365. We're a huge employer. We employ over 117,000 people in the public health sector, which is equivalent to the population of County Clare, and everybody knows somebody from County Clare. So in relation to the drivers, so I've moved on now to sustainability drivers. Well, a couple of years ago, I actually wrote within the estates function a guidance for our own staff on what it takes to build and maintain and refurbish a sustainable healthcare building. Because I was conscious that there were so many different pieces of legislation falling out of the sky that we had to comply with. So we wrote our own guidance, and that slide just summarises the kind of things, and we're happy to do it, we have to comply with in terms of how to build or maintain a sustainable building. So it's the building regulations, energy specification towards NZEB, construction phase, particularly looking at construction and demolition waste, green procurement, energy management, wastewater discharge with regard to our catering facilities in particular, and waste management in general across the range. We have healthcare risk waste, we have food waste, we produce it all. So that's just one slide to show, let's say, what we're dealing with in terms of specification of a healthcare building, which in itself is already quite complex. This is my favourite bit. This is the stuff that gives me joy, gets me up in the morning. It's when the HSE staff, and there's a huge appetite amongst our staff for sustainability. They ring us on a day-to-day basis, Helen, how can I make my office, my team more sustainable? And this is the stuff that they're asking us to do. We did a survey of the HSE, how to make the HSE in general more efficient in 2012. And a big theme came out was sustainability. And that's why the National Health Sustainability Office was set up in the first place. So again, it's the obvious stuff: energy efficiency, recycling of ICT equipment, doing less printing and more electronic communications, connecting to work using healthy public transport, lights off, when we all go home, PCs off at the end of the day, waste prevention, recycling, etc., teleconferencing, meeting less and doing more by teleconferencing from our offices. A little bit on green procurement, even though staff mightn't have been aware that that's what they were actually asking for, and water conservation. This predated the domestic water charges, so I say that's higher up in the scale now. So taking all that into account, we set up the National Health Sustainability Office in 2014, and we tried to access sustainability in the HSE through 7 pillars, starting with engagement, the most important one. Because if you don't have that, you have nothing. And then we worked our way down through energy efficiency, water conservation, waste prevention, sustainable transport, green procurement, and the built environment. And I think that probably should include biodiversity as well. So I'm going to start with what I think is the most important one. And given that I work within the estates function, it's not what you would expect. Green procurement. So a lot of what we procure is actually not controlled by the HSE. That's the first thing I'd say. Since 2014, much of what we procure for our offices, our hospitals, is procured by the Office of Government Procurement. So there's a lot of guidance on green public procurement, but unless the Office of Government Procurement actually incorporate green criteria into their contracts, we can't implement green procurement within the HSE, except of course for construction, and we have developed our own guidance in relation to green construction, and we do an awful lot of work in that capacity. So it's vital. And again, a lot of it is out of our control, and it's out of the control of a lot of the public sector, because the Office of Government Procurement procure on behalf of us all. And the reason why I bring that up is that the NHS have, they've studied the stats, I suppose, a bit better than us in terms of the carbon footprint of the NHS. And a lot of it is to do with procurement. 24% is to do with our buildings. We're quite good at that side. Then 66% is to do with what we buy. And then travel is the remainder. And the NHS, for example, would have procurement officers who specialise in sustainability. They would have ambulance officers that specialise in sustainability. So they're looking at what is creating the carbon footprint of the NHS and then allocating the resources accordingly. Again, within procurement, we actually maintain a good deal of the procurement. The HSE procure our own pharmaceuticals and medical-related devices, etc. The non-medical healthcare stuff is procured by the Office of Government Procurement. So this year, for example, we would have taken the single-use catering ban that was announced in March, and we would have developed our own guidance specifically for HSE managers and catering managers in particular on how to navigate the Office of Government Procurement frameworks in order to put in reusables instead of single-use plastic, and to reiterate to them that the compostables are not an alternative. They're only to be used within exceptional circumstances. So we developed our own guide, and we've issued that to our staff. Also, HSE Procurement, for example, this year would have put in a new contract which has brought in reusable healthcare risk waste containers, sharps boxes. They're plastic, but they are for the first time reusable, and they're available to our acute hospitals. So we are doing a little bit in terms of green procurement. On energy efficiency, I'm delighted to say this year we actually have 8 regional energy managers appointed within the HSE, co-sponsored by the SEAI, it has to be said. And they're there to help endorse what we've been doing ourselves, which is providing energy training, technical and non-technical, to HSE managers. We have 22 acute hospitals participating in the Optimising Power at Work campaign. We have 10 acute hospitals that participate in the big switch off over the bank holiday weekends. And Mullingar Hospital, they won last year, and the winners for this year will be announced in the new year. And they were able to reduce their energy demand by 15% over 2 bank holiday weekends, which in an acute hospital setting is a very complex thing to do. How is the HSE doing overall? Well, these are our reporting that we do back to the SEAI every year, and the HSE is on target and has reduced its energy savings by 25% since our 2009 baseline. But obviously the targets are increasing, and we have an awful lot more to do. And one of the things that we're going to have to really look at is the decarbonisation of the health sector. We looked at that earlier. We're not doing enough in terms of renewable energy. It is quite complicated in terms of an acute hospital setting particularly. So we have very little in terms of renewables, but the 30% of the electricity that we procure through the grid, through the Office of Government Procurement, is renewable. So we have a programme that was co-funded by the Environmental Protection Agency called the Green Healthcare Programme, where instead of looking at stats from the UK that were out of date, we actually developed our own stats based on our own hospitals. We benchmarked our own hospitals in terms of the waste that they're generating according to their activity, so they could benchmark themselves against the hospitals in their area. We produced our own statistics, and then we produced our own best practice guidance on healthcare risk waste, food waste. For example, the HSE can save up to 11 million euros in terms of food waste per annum if we apply our best practice guidance. We developed case studies, etc. We provide waste reduction training for hospital staff. From this year onwards, we're going to be funding that programme solely by the HSE itself, but the programme was initially co-funded by the HSE and the EPA, and we thank them for that. As part of that programme, we also developed healthcare-specific best practice guidance for acute and community hospitals, where to start in terms of an acute hospital, leak detection, etc., things like that. Water conservation in an acute hospital sector is quite specific. We are the second largest customer of Irish Water, spending about 8 to 10 million per annum, and we have partnered with Irish Water to provide water stewardship training to some of our engineers within our hospital, and they sign up to a water charter and they progress from there. But it's going to have something that we're going to have to ramp up considerably, because the price of water for all HSE locations, depending on where they are, is going to increase by between 30 and 50% from May of next year. So I'd be the first to say that an annual seminar does not deliver sustainability, but we do engage with our staff on a day-to-day basis. But then we have our annual engagement, which this year is in Athlone. And we have 200 HSE managers and staff invited and attending, which is great. The attendance, we sold out quicker, let's say, this year than we have before. I think 2019 has been a pivotal year in terms of climate action. I feel it myself in terms of engagement with our own staff. We're inviting our staff to come along to calculate their own carbon footprint, compliments of the Climate Advisory Council, and then to make a pledge when they go back to their office. What are they going to do? What are they going to do until next year's seminar? So we're looking at the same topics that we've covered today, but specific to the HSE and to healthcare: climate action, adaptation plans, energy efficiency from the design right through to performance of our existing buildings, ditching the disposables in terms of catering, lean thinking, which is something I think will help the health service deliver a lot in terms of sustainability, particularly on the procurement side, water conservation and charges, and then Healthy Ireland are there as well in terms of delivering the Sustainable Development Goals. So if any of you are HSE staff members and you haven't registered already, there are a couple of tickets left. So Simon Harris, I'm going to let the boss of the boss of the boss have the last word. And he said that climate change, and he said it in July of this year, he said climate change will have profound implications for the health and well-being of Ireland's population. So is the HSE as an organisation as large, are we having a profound impact on our own climate actions? Are we having a profound impact on our own carbon footprint? We're certainly doing as much as we can with the resources that we have. The best resource we have is our staff. Every day they're trying to come into work to apply their sustainability values that they've taken from home into work. And every day they give me the reason to keep going. So this is our website. All the details are available. That's our email address. And if you haven't visited our stand, we're over in the corner just outside with tea and coffee. And thanks for listening.